So good day, I am Joycee and Losa. I am from BSN 1E, and today I'll be doing a written demonstration regarding the assessment of the female genitalia, the anus, and the rectum. So first po is, before going to the client, I have to ensure that all of the materials or equipments that I'll be needing is already gathered and prepared. So this material includes a stool, light, a speculum, MSS basin filled with warm tap water, also a surgilope, a cotton tipped applicator, a chlamydia culture tube, a culturette, also a test tube with water, and then a sterile gloves, a ivory spatula or wood stick, and then a feminine napkin. And then after that is I'm just gonna go to the client po and then introduce myself and explain the procedures that I'll be doing. So, just gonna go to the client. Good morning po, ma'am. Ako nga po pala si Joycee and Losa. Student nurse po ako from Camarines Polytechnic College. Maaari ko po bang malaman ang inyong pangalan at ang inyong birthday, ma'am? Okay. So, ma'am, sarado ko lang po ang pinto for our privacy. And ngayon po, ma'am, ang gagawin po natin is ang assessment ng inyong female genitalia, ng inyong rectum at ng inyong anus. So, importante po ito para malaman kung meron po ba kayong problems or abnormalities na related doon. Also, ma'am, to evaluate po your urinary, your reproductive, and your sexual function. And to facilitate po early detection if may problem ba, and treatments po with preventive care and patient's education. So, before that po, let me just do hand hygiene. And while I'm doing the hand hygiene, can you please put on the gown po? So, assuming that I have already do the hand hygiene and then the client already put on the gown and na-ready ko naman na po yung equipments, as I'm gonna start na. So first is on the external genitalia, is we have to inspect for the mons pubis, note for its the pubic hair distribution and infestation. So we have to inspect po, and then the pubic hair distribution po should be in an inverted triangular pattern, and there should be no sign of infestation. After that is have to inspect now for the labia majora and the perineum. Note for the swelling, lesions, or excoriation. So upon inspecting po, it should be symmetric in size, the labia majora, and then the perineum should be smooth. And then there should not be sign po of swelling or lesion or excoriation. And then after that, I'm gonna inspect na the labia minora, the clitoris, the urethral meatus, and the vaginal opening. So, have to note po for the swelling, the excoriation, also the lesions, and if there is a discharge. So, the labia minora po should be symmetric as well. It should be dark pink and smooth po. The clitoris naman po should appear small mound of erectile tissue. It is sensitive to touch, and the urethral meatus should appear small and slit-like, and the vaginal opening po varies depending on the client's sexual activity or vaginal delivery. And then after that is you have proceed na to palpating of the Bartholin glands. So if may swelling, if may history ng swelling, or may current swelling na na-observe, we have to note for the swelling, the tenderness, and also the discharge. So dapat po it's smooth, walang swelling, and it is soft and non-tender. So wala din dapat discharge. After that is have to proceed na to the palpation of the palpate of the urethra. So if the client po complains to a urethral symptoms or urethritis, or if may na-observe na inflammation sa skin glands, we have to palpate for the urethra. So by inserting the gloved index finger on the superior portion of the vagina, is you have to milk the urethra from the inside, pushing out and up po, and then observe for the drainage. And then after that is the internal genitalia na. So we have to inspect for the vaginal opening and the angle of the vagina. So by inserting the index finger on the moistening muna pala of the index finger, and then inserting it gently onto the vaginal opening. And then after the vaginal opening po, again, varies the size depending on the age, the history of its sexual activity of the client, and also po whether the client given birth vaginally. And then after that is assess na for the vaginal masculation. So by keeping the index finger inserted on the vagina po, so I'm gonna have to ask the client to squeeze around your finger, and then after that is using the index and middle finger, gloved index and middle finger po, is gonna have to separate the labia minora, and then ask the client to bear down, and then note for bulging or the discharge of urine. So dapat po there is no bulging and urine discharge. And then after that is gonna have to perform na the speculum examination. So first is to inspect the cervix. So inspect the cervix for color, size, the position, and then also po we have to inspect na for the OS, and then the surface, and then if there is a discharge or lesions. So dapat walang lesions, there should not be swelling as well, dapat smooth siya. And then after that is gonna have to obtain a culture for obtain a culture or specimen for pap smear, or if indicated po, obtain a culture to test for STDs. And then next is to inspect the vagina. So unlocking the speculum to inspect for the vagina, while the partially open speculum is rotated and removed. So we have to observe for the color, the consistency, and if there is a discharge po, and also the surface. And then after that is gonna proceed na to perform of the bimanual examination. So by placing the non-dominant hand onto the lower abdomen, is we have to insert the glove lubricated index finger on the vaginal opening. So while pushing the posterior wall po, is we have to wait for the opening to relax. And then after that is we have to palpate for the ovaries. So by sliding the intravaginal fingers on the right lateral fornix, you have to attempt to palpate the left and right ovaries. So noting for its size, shape, and then for its tenderness or mobility and consistency po. And then after that, once the fingers po is withdrawn is we have to inspect or observe also for the secretion. And then after that is we're gonna have to do na the rectovaginal examination. So with this naman po, by changing the gloves of the dominant hand, is we have to lubricate the index and middle finger po, and then after that is have to ask the client to bear down, and then insert the index finger onto the vagina, and then the middle finger onto the rectum, and then while pushing po for the pushing down the abdomen wall, is we have to palpate for the internal reproductive surface, so through the posterior rectal wall. So while my attention to the area behind the cervix, and then the rectovaginal septum, the cul-de-sac, and the posterior uterine wall. And then after that po is gonna have to proceed to the anal and perianal area. So with this, we have to inspect for the lumps, ulcers, lesion, redness, or rashes. So if there is po, we have to note for its size, shape, location, distribution, and configuration. And then after that is inspect na the sacrococcygeal area for swelling, redness, or dimpling, or if there is a presence of hair on the pilodonal area. And then after that po is inspect for the rectal prolapse while the client is doing the Valsalva maneuver. And then after that is we're gonna have to palpate for the sphincter tone for tenderness, for nodules or hardness. And then next is to proceed na to the rectum. So with this po, we have to palpate for the rectal mucosa. So for tenderness, nodules, or hardness po. And then next is palpate for the peritoneal cavity for tenderness, nodules, or the rectal shelf. And then once the gloved index finger po is removed, is we have to inspect the feces for blood, and then do occult blood test. And then after that is do na the aftercare, and then hand hygiene, and then document po. And then for the analysis of data is we have to formulate a nursing diagnosis, and then formulate a collaborative problems, and then make necessary referrals. So that's it po. Thank you for watching.